So celiac disease is a lifelong condition, though it can be diagnosed at any age. The symptoms vary greatly. We know that only about 1 in 8 individuals in the UK who have celiac disease have actually been diagnosed, and a lot of the undiagnosed patients we think have no symptoms at all. However, the common symptoms are due to poor absorption of nutrients, and this can cause diarrhea or weight loss. And in children, it may impair growth. More commonly now, what we see in people with celiac disease is less specific symptoms, things like bloating, abdominal discomfort, anemia sometimes, and fatigue. And because the tests that we have for diagnosis are so good now, we are picking up a lot of patients who have really very mild or no symptoms at all. So the diagnosis usually requires both a blood test, which is a celiac antibody test, and also a biopsy from the small intestine. Biopsy is usually taken at a test called endoscopy, which is done in hospital, and it involves putting a small telescope-like instrument, a flexible tube, through the mouth and into the small bowel to take some biopsies. And it can be done under light sedation or just with some anaesthetic spray to the back of the throat. So it's a straightforward procedure. In some children, however, it's possible to diagnose celiac disease without the biopsy, but it depends on assessment by an expert and by the levels of the blood tests taken. The treatment for celiac disease is a lifelong and strict gluten-free diet. We know that if patients are able to follow the gluten-free diet, then the vast majority of them will be very well and will not have any problems from their celiac disease in the longer term. Celiac disease, again, in most patients who are able to follow the gluten-free diet, the outlook is very, very good. There is a very small increased risk of a rare kind of cancer that affects lymph nodes called lymphoma, and also a rare increased risk of certain types of infection, including pneumonia. However, for the majority of patients, the prognosis is excellent, as I said, and we know that more serious complications like death and the prevalence of other cancers is really the same as for the general population in people who do stick to a gluten-free diet.